Makes sense. So a lot of people have been talking about and interested in, the role of root canals. Can you tell me why, or tell our listeners why root canals are so darn taxing on the body and so dangerous?
Well, you have to understand that we're the only profession that embalms an organ and keeps it into the body. So you're talking about a dead organ.
Mm-hmm.
When when the nerve dies, you get breakdown products of protein, some of which are thioethers, which are related to mustard gas. Plus the fact, when you have a tooth that died, there's a reason for it. There could have been trauma, but more than likely there was some infection within the tooth that got to the nerve that caused it to become necrotic or dead. Those bacteria live in the little dental tubules.
Mm-hmm.
To give you an example, Justin, a molar tooth has approximately 3 miles of dental tubules. They're 4 microns in diameter, which is like minuscule.
Mm-hmm.
And these bacteria live in there, and they pump out their poisons. And these poisons literally get into the lymphatic system and get carried away to the thyroid, the thymus, the heart, and the rest of the body.
And so it's true that, each tooth corresponds with a different organ in the body. I think there's some truth to that, right?
Well, yes, embryologically, the teeth develop from the same cells as the autonomic nervous system. So to give you an example, your front teeth, the canine, develop from the neural tube when the fetus is growing, which gives rise to the same sympathetic nervous system. Mm-hmm. Your posterior teeth, your bicuspids back to your wisdom teeth, develop from neural crest cells, which is your parasympathetic. And it was Reinhold Voll in the 50s. He was a German, East German physician that linked the different teeth to different organs.
Wow, that's so amazing. So if someone's out there that has or is looking to get a root canal, what would you suggest they do?
Well, under certain circumstances, I'll do a root canal.
Uh-huh.
And by that I mean that there's no large infection, and the pulp had recently died, and we use ozone in the canals. We test all the materials in the canals, mm-hmm. so that they're biocompatible. And because here you're caught between a rock and a hard place. If you lose posterior support, you lose stability to the cranial sacral system.
Mm-hmm.
But there's ways of kind of cleaning the area. I have 2 root canals in my own head,
mm-hmm.
and I use the Rife technology. It's RIFE. Mm-hmm. Like once a week prophylactically, just to keep any infections or problems, down to a bare minimum.
Mm-hmm. So now on the root canals, I have one now, and I'm looking to do something with it in terms of, fixing it, because I had mine done before I knew better down in Mexico. God only knows, the kind of equipment they were using down there. And so some people say you should pull the tooth. Is that something that you think should be done? Well,
I'm very conservative,
uh-huh.
and I would strongly recommend having the tooth tested.
Okay.
There's any number of ways that you could do it. If, for example, thermography was used,
mm-hmm.
thermography delineates temperature changes, and if a hot spot or it's showing up red in the area where the root canal is visible, mm-hmm. then you know that there's inflammation going on there. You could also use, Voll technology or Indigo system or Avantar. There's so many different electronic diagnostic systems that could be used. Okay. And then using a muscle testing technique called direct resonance testing, where we have vials of specific frequencies of pathogens, and you can literally delineate what pathogens are present in the area of that root canal.
Okay. So now how does removing a tooth during, for a root canal, affect the proprioception of the jaw and the structural balance? How does it start affecting, if you remove a tooth, the overall balance of your jaw, your shoulders, your hips, and your knees, and all that kind of stuff?
Well, number one, you have the proprioceptors are taken out of the socket with the extraction. And number two, you're losing the physical contact to the opposing tooth. Okay. And that affects the cranial bone balance.
Okay. Oh, and so once your jaw is out of balance, then that is it sort of like the slinky deal where it starts affecting the whole rest of your body? The whole rest of your body has to compensate. Is that correct? Correct.
You basically have 28 bones that make up the human skull.
Okay.
And they're joined together kind of like in areas what I refer to as like little zippers. They're sutures. They're expansion contraction joints.
Okay.
When the forces become imbalanced, the sutures distort in their balance, which affects the dural membrane system within the cranium. And that dural membrane system passes through the base of the skull. It attaches to the upper 3 cervical vertebrae, and then it goes all the way down to your sacrum. So there's your slinky.
Right. I just shudder. I talk to people all the time, and they tell me, I have to get a root canal, and they talk about it as if it's no big deal. And, some people know, that I know really well, know what I do, and they ask my opinion, but some people don't know what I do, and they just, say these things. And do you just shudder when people tell you these types of things and they act as if it's really just not a big deal?
Oh, absolutely. It's mind-boggling how the establishment has sensitized the population to accept disinformation. Back in the 30s, Weston Price, who was had impeccable credentials as a researcher for the American Dental Association, and they took infected teeth out of patients, put them under the skin of healthy rabbits, and the rabbits came down with the exact same disease that the patient had.
Wow. I've heard about that. I think there's something that I heard recently about some sort of toxin that the bacteria produce called propionic acid. And when a tooth is, extracted from someone who had autism, and, there was parts of that tooth that was injected in the rats, I think, and they started exuding, autistic behaviors. And it's just amazing that kind of research is going on, and yet no one knows about it.
Well, sure, because it smacks it right in the face of what the establishment is putting out, is that vaccines are safe, and chemicals are safe, and fluoride's safe. The bottom line is the average child today being born has, on average, 287 chemicals in its blood at birth. This was well documented by the Environmental Working Group. They spent $50,000 on each of 10 children, and they tested their blood by taking it out of the placenta at birth. And it's mind-boggling to think that you have this human fetus developing in a cesspool of chemicals for 9 months. They get out, then they want to inject them with a hepatitis B in a hospital when they're like hours old. It's off the wall.
When you start realizing all of this stuff, it just makes so much sense, doesn't it? Why people are getting sick, why there's autism, why there's cancer. I have a friend of mine who, I went to high school with, and she's got stage 3 colon cancer. I mean, it's just, if you don't really know what's going on, it seems as if these types of things are coming up out of the blue. But when you start understanding, like you were just saying, how we can't even live the first few days without being exposed to hundreds of toxins.
Well, it's one of the reasons why I wrote a book called Reversing Cancer, because my wife went through a stage 3 ovarian cancer, and I saw the intimidation techniques that the establishment uses to coerce people into chemo and radiation and all the invasive techniques. And I swear, I spent like 3 days in the hospital after my wife had surgery, and I was so disoriented from not being able to sleep with code 4 messages in the middle of the night. I could have been selling flowers at the airport. But the key here is that you have a multitude of factors that are, placed upon the individual on a daily basis. You have the radiation coming over from Fukushima. That's over a year ago, but every day we're getting inundated with radiation. And they're not talking about it on 11 o'clock news because they don't want the people, fearful. But there's nothing that they could do about it. But the establishment doesn't realize that with simple intake of iodine and a special nanizeolite product, you can negate the radiation effects.